Okay, I'm going to screen share now so we can get started. Impacts of Water Immersion Births on Mother and Infant by GeriVanDyken. Water immersion birth is an alternative birthing option where the baby is delivered submerged under the water. This is different than laboring in water, where the mother spends time in the water during labor, but actually delivers the baby on dry land. Water immersion births can be traced back to the Greek and Roman times. However, it's been increasingly popular in the United States since the 1970s. More women are interested in alternative options for laboring and childbirth, and water births are gaining in popularity. Positive and negative impacts of water immersion births will be examined in this presentation. Water immersion births offer many positive physical and psychological impacts for women. Women are found to have shorter stages of labor and less need for medical intervention during childbirth. The use of epidurals and pain medications are greatly decreased due to women reporting less pain with their water immersion birth. The decrease in pain is thought to be in part due to the buoyancy of the women being submerged in the water. Women who had water births also had lower blood pressures during labor. This could be due to the decreased levels of pain and the reported decreased stress levels that they have. Women who choose to have a water immersion birth are more satisfied with the way their labor and delivery is unfolded than other birthing options. They feel more in control of their bodies during all stages of labor. There were few negative maternal impacts of water immersion births, but one study did show that women had an 11% increase in risk for genital tract trauma. There wasn't any relation in the type or extent of trauma to the genital tract or consistent patterns found in the research. Perineal lacerations were also more common. Maternal risk factors for infection and postpartum hemorrhage was the same for water immersion births as it is for other birthing options through the vagina. Infant impacts of water birth. Studies have shown that there are no positive impacts for infants who have a water immersion birth. That isn't to say that there aren't any benefits for an infant with water immersion birth, but it doesn't offer any advantages that an alternative method of a vaginal delivery could for the infant. Most research that's been done on water immersion births includes a small sample size, so it's possible that with more research, the positive impacts specifically from water immersion births for the infant could come about. Negative impacts of water immersion births for infants are rare, but they are serious. These include inhalation of water, hyperthermia, and snapped umbilical cord. The risk for infant infection, APGAR scores, and intensive care unit needs are the same as other vaginal birthing options. There are limited research studies on the impacts of water immersion births, but case studies have recognized both the benefits and risks for this type of birth experience. There are some general themes that are repeated in each study done on water births, and these are generally accepted by birthing professionals. However, large numbers of studies are needed, and larger numbers of women and infant participants, and larger trends need to be established before the safety of water births reaches a common acceptance among all professionals and women choosing this as a birthing option. What professionals can agree on is that laboring during the first stage of labor immersed in water is beneficial for the mother and infant. Decreased pain, less medical intervention, relaxation, and quicker labors are all benefits of laboring in water. Laboring in the water is agreed to have a positive impact on mother and baby. However, birthing in water is debated among professionals as to whether it is safe. Women are becoming more and more interested in how their choice of birthing methods affects both themselves and their infants. Water immersion births have been shown to decrease maternal pain, decrease the need for medical interventions, and increase patient satisfaction. Maternal risks associated with water immersion births include genital tract trauma and an increased risk of perineal lacerations. Infants are subject to the same benefits and risks as alternative vaginal birthing options. While there are both positive and negative impacts from water immersion birth, more research is needed to gain a better understanding and a more widely accepted decision on the safety of water immersion births so that all professionals can come to an agreement about whether it is a safe birthing plan to offer mothers. Women who are informed and educated about this type of birth can make a decision as to whether it is appropriate to choose for them and their babies. These are the references used in the presentation, and all of the photographs that are not cited within the presentation are original photos of myself. Thank you.